This is our first meeting of the Future Health Professionals Club.
I am Ms. Stefaniak. I teach 8th grade Earth Science. In my free time, I like to cycle and find trendy new places to eat. I would like to go to medical school, and I am currently studying for my MCAT, taking it in January. I want to pass on my knowledge that I've learned as a pre-health student in college and throughout high school and help you achieve your goals.
Hola, I'm Miss Martinez. I currently teach 11th and 12th grade Spanish, and so I'm hoping to get to know you guys better. A little bit about me is I like photography and dance and culinary arts and just hanging out with friends. And so what we're going to hope to do this year with you guys is try to inspire you and encourage you to continue your journey in the pre-health profession. And I have a little bit of background in that, so I'm looking forward to sharing any insights I can give you.
We, the club council, will begin by introducing ourselves. Then after introductions, we will go over our goals for the semester. Next, we will split into our classes and complete a survey describing our interests and hopes and goals for this semester. Finally, we will conclude with get to know you activities. Hello, I am Hannah Imoki. My role here is the president of this lovely club, and I'm a senior. I love working with people, and I want to be a physician. That's the main reason that I am here. And I joined in order to learn about what the medical field is and the ins and outs of it.
I am Zaya. I'm a junior and I play football here at Trivium. My goal in joining this club is to learn more about becoming a PA. That's what I want to do in my future. And I joined to learn more and to get more experience of what the medical field is like.
Hi, I'm Daniel McLeod. I'm a junior. I love Tolkien and to study history on my free time. I want to be a field medic in the National Guard, and I joined the club so that I could deepen my understanding of the medical field and gain experience from it as well.
I'm Sammy Johnson. I'm a junior here and I play varsity soccer, and in the future I would love to study sports medicine, and I would just love to have the opportunity in high school to learn more about health and medicine professions before I go and study them in college.
Hi, I'm Vincent Joseph. I'm a freshman here at Trivium, and in my free time I like making beats using softwares that I can find online. And in the future I would like to become a physician, but that's just general. I don't know what specialization I want to go to, but I would definitely want to do one. And I joined this club to further my understanding in the medical field and gain new knowledge that I can use to further my future.
We're going to go over the big concept for this semester, which are our goals. What we have come up with as the club council to learn how to learn,
And to practice teamwork and better our trust in one another.
To learn about what the medical field is and its pros and cons.
To learn about how to approach entering the medical field, both in high school and in recommendations.
And also to learn how to properly communicate.
and we're going to end off with a quote that I found online, which is one of my favorites. Isn't it a bit unnerving that doctors call what they do practice? Thank you. Any questions? We're going to work on the cranial nerves exam. So we're going to be looking through the packet and looking at the different parts of the brain and their functions. Then we're going to do a Quizlet at the end of it. And then after the Quizlet, we'll be filling it out on the brain sheet. Does that make sense? Questions?
We're confused.
I think it's vestibular trochlear.
Vestibular.
Right here. Right here.
I want to hear your overall experiences that you had your first week. Or maybe if we can go around and just share one thing that you were maybe surprised by or really excited to see.
I shadowed the Foothills physical therapy place, and I was really excited because I already did the sportsman internship with Kayla, so it was fun to see like other people do what she does.
I shadowed the ENT, and I was really excited because we got to watch a surgery in the clinic, and I guess he's really advanced for someone that works in a clinic because he can do like the full surgeries and things, and he uses this little camera thing so we could like not only see him, cause like he's up in the nose, so it's like hard to see, but then like you could see it through the camera, and then you could like see him like as he pulled stuff out and things like that, so it was cool to like see both angles.
Dr. Wayne Horn with Corinne, and I just thought it was interesting how like I feel like when you think of surgery you think of like really clean and really serious, but when he was doing like the sinus surgery, all the stuff was like, I think they said it was like half sterile, so like it didn't have to be like completely clean because it was like in the nose, so he said it was like already pretty dirty and stuff in there anyways. So
I shadowed Kane orthodontist, and I just thought it was pretty cool because like when I had braces and I went into the office, I'd be like, I didn't know what they were putting in my mouth. So I thought it was really cool to learn about like all the stuff they would do, like because everyone coming in has braces, and we got to see someone get their braces off, so it was pretty cool to like watch them do with all their little tools to see what they did.
I shadowed Dr. Du and was in pharmacy. So we went to her own pharmacy clinic, and she talked a lot about how it's different than working for like one of those big brand companies like Walgreens, CVS, and stuff like that. And she said like she was talking more about the job itself, less about how she got into it.
I shadowed Dr. Holt. He's an optometrist, and he has a small clinic, so it wasn't super busy. So compared to where like I go for my eye checkups, it was a different kind of perspective. But you still have the same things. It was really interesting how he was able to like change someone's prescription or like check up on their eyes.
I went to Dr. Kane Orthodontics. I thought it was pretty interesting, all the tools they use and how simple they made it look. They did it all with ease. I thought it was like a really nerve-wracking like profession. And no, the mood there was like really calm and chill. So yeah, that was pretty cool.
I went to Dr. Rusick, the chiropractor, and he let us use a massage chair. So that was cool. But it was also interesting that like how much of like massage they put into it before he actually adjusted his patients to loosen up the muscles. So that was interesting.
Did you get to see any of like the electrode, like I forget what it's called, like the
He did it to my arm, and he put like 4 on, and my arm like curled up. It was really cool, actually.
I also went with Sarah to the physical therapist for Foothills physical therapy, and what I was most excited about, because I have been in physical therapy before. I still kind of go sometimes because of a car accident I was in, so the left side of my body is in more pain than it should be, and so from going to physical therapy, I have seen like the patient's point of view from my experience, and then also what the like pre-PAs and all the PAs would do from their perspective, and like how they organize and how they schedule things and how they take care of the patients, and that was just really fun to see from 2 different points of view.
When we were there was like a kid in the corner that they were working on, and I think he had just gotten his braces off, and they were, you know how when you go into an orthodontist they do the mold and they put it in your mouth? And okay, well he didn't seem to like that very much, and he's kind of had a meltdown, and I was like, and I've seen that too at my orthodontist, and I was like, I've always wondered how they handle that. Like he's like, don't put that in my mouth, and I was like, they need to put it in your mouth. And so the Dr. Kane came over and he was just like, oh, it's gonna be fine, and they were like, oh, you just need to hold your breath for 10 seconds and we'll take it out, and then he let them put it in his mouth. So he ended his meltdown.
So definitely how the patient-physician relationship is formed, right?
Yeah.
There's a certain sense of authority, but also respect, mutual respect towards each other, or at least there should be. And so obviously the patient wasn't in the best, because most of the time, I mean, you don't go to the doctor for pleasure, right? It's probably not a good day to begin with if you're going to the doctor. So there has to be a certain sense of respect and understanding that goes into any patient interaction. Okay.
On the same person at the same time to like help him breathe better. So he like used this little balloon to open up the sinuses, and then he like straightened out the middle part of his nose by like removing the cartilage. But then there was this one part where he had to like clear the like cavities, I guess, of like diseased skin. So he had this tool that was like a stick with little teeth things on the end, and they like moved, and he just like shaved off, but they were like whole chunks of skin, and we were like, is none of that important? Because he was just kind of like he would clip it, and then he would pull stuff out, and he'd just like shave it all away. And so I don't know, it's just weird to me that like there's that much, like it's not like buildup, it's actual tissue, but because it was diseased, he just took it all out, and it just seemed weird that he could just like he wasn't being like super precise with it, you know? He was just getting rid of all the extra stuff.
The patient, when he was in his like kind of surgery, he could still be able to talk and stuff, but like one of the assistants ladies, she was explaining to us that even though he could talk and kind of like move around a little bit, he wouldn't know anything that was like happening, so it's just all kind of random. Like, so he would say like, I think I'm gonna sneeze, and it was all in his nose, and so I was wondering, I didn't ask, I didn't get a chance to, but like, what would happen if that actually happened?
I do want to know about the systems in a pharmacy, because all offices need to have a good system. And so in order to keep all those medications organized and not accidentally give someone the wrong thing and kill them, I want to know like how they keep all that organized, because it doesn't matter what profession you go into, you must have that organization.
Once we kind of like warmed up to the doctors, we got more comfortable, and then I started asking her more questions.
Do you feel more comfortable now going into the second week? Which I think a lot of you may be wondering why I picked 2 weeks, but it's for that exact reason. And after you kind of absorb the whole situation and you sit down in your own environment to think about it, maybe you'll have new questions or things, wondering about things that maybe you saw or maybe didn't see, and then you get the opportunity to ask the following week. Reflective journaling is the key here. And then the reason I say that is because, especially once you get to see more patient interactions, studies have shown that empathy levels decline. And since you're starting off at such a young age, I want to make sure that it doesn't happen to you. So reflective journaling is the key. If for some reason you can't make it like ahead of time, just let me know so that we can contact them, because they'll be waiting for you guys to get there, especially if we tell them that you're coming. Or they'll get worried, like most parents do, right? Because they are parents of Trivium, right? So their students go here, and I think that's the best part about having them be part of our community, that they genuinely care about you and that they genuinely want to teach you. Do we have any questions for this week? No, we all know where we're going.
For more information about the Future Health Professionals Club, please email one of the club advisors, the school nurse, Ms. Cornelius, or please visit our website.